So how is this surge in cases impacting our local hospitals?
So Ian Smay asked Providence's chief medical officer today. He gave a stern warning about the impact Omicron could have here locally. Ian?
Dr. Dan Getz said the impacts of the Omicron variant are compounding the already present staffing issues that hospitals are facing. If this new variant leads to a surge and hospitals continue to suffer staffing shortages, Getz said the state could be on the way to crisis standards of care. With early studies showing that the Omicron variant of the coronavirus could be 2 to 3 times more contagious than the original, Providence's chief medical officer, Dr. Dan Getz, painted a grim picture of what this could mean locally.
When you look at how contagious Omicron is, unfortunately, probably everybody's going to get a shot at getting this thing. And that's why it's so important to get people vaccinated and really protect themselves as much as they can.
Part of protecting yourself against the coronavirus is wearing a mask in public indoor spaces, such as grocery stores. But according to Getz, people are worn out when it comes to taking precautions against the pandemic.
We know many people are experiencing pandemic fatigue. Mask wearing in the Spokane area has really gone down. Stores can't enforce it, and this is not the time to walk around unmasked as we see this variant spreading quickly through our state.
The impacts of Omicron have also reached those working in healthcare settings. Hospitals have been facing a staffing shortage for months. Getz says this is made worse by staff members being sick with COVID themselves or being exposed and having to show a negative test to return to work. If a heavy spike in hospitalizations caused by COVID coincides with a large amount of hospital staff being sick, Getz said it could lead to dire consequences.
We're already at a point now where staffing is incredibly challenging, and if we see lots of ill calls and a high volume of patients, this really could drive the state into a crisis standards of care setting.
According to Getz, those staffing issues are also impacting how much testing Providence can carry out. He also said providers are not only dealing with a high amount of COVID patients, they're also treating other illnesses or performing surgeries that may have been delayed during previous surges. Getz also said high capacities locally also might impact how many transfer patients they can take from more rural providers. Getz also said that the one characteristic that most people hospitalized with COVID-19 currently have in common is the fact that they are unvaccinated. In the newsroom, Ian Smay, KREM 2 News.